Hi, Miss Carol. How are you today? My name is Angela, and I'm a student clinician who will be seeing you. How are you?
Good, thank you.
What brings you in today?
Well, I have been having some symptoms for off and on. Basically, my stomach hurts. And
Stomach hurts? Okay.
yeah,
When did it start?
it's been kind of off and on, but really bad for the last few weeks.
Okay. And where exactly does it hurt at?
Well, it just kind of feels like when I eat my food that it just kind of sits in the my throat after I eat, and then sometimes I feel nauseated too, like kind of like indigestion.
It's
Over
not
the
indigestion.
over
Okay.
the sometimes I take Rolaids or Tums and it helps a little bit, but then it comes right back.
Okay. So how long does it last usually? Just after you eat?
Yeah, just after I eat.
After you eat. All right. And so the food makes it sticks in your throat?
Yes. It makes it, that's what it feels like. I don't think it is, but that's kind of what it feels like. It just sits there in my stomach. It doesn't want to go all the way down or be digested.
Okay. All right. No vomiting?
No.
Okay. Does it hurt in your stomach too? Or just in
Mm,
your throat?
just mainly in my throat.
Okay. All right. And you said Tums and Rolaids helps a little bit,
Yeah, the antacids, they help a little bit.
but it doesn't happen any other time except when you eat?
Yeah, just when I eat.
Okay. All right. What are some of your past medical history? Have you ever had like acid reflux or anything like that?
No, let's see. I was diagnosed with type 2 diabetes, but I don't have it anymore, so I don't take any medications or anything for it. Yeah, I mean, well, I had lap band surgery about 5 years ago, and I was pretty big then. My BMI was 38 when I had that done.
Okay. All right. And so besides the lap band, any other surgeries?
No.
Okay. Any children?
Um, yeah, I have one child.
Okay. All right. So what about family history?
Mm,
Mother, father?
they're both all healthy.
Okay. Siblings?
One passed away after he was hit by a train, and a sister who's healthy.
Okay. Children?
My children?
Uh-huh. Your
Yeah,
child?
my one child's fine and healthy.
Okay. All right. Okay. Any other problems such as stress at work or problems at home? Anything like that?
No,
Any
no.
alcohol or drug use?
I work as a night shift RN, and so I don't take any drugs. Sometimes I have a glass of wine after dinner on the evenings that I don't work.
Okay. All right. Okay. I'm going to ask you, it's going to seem like a lot of questions. Going to be yes or no questions, and you just bear with me for just a little bit. Have you had any weight change besides with your surgery?
Um, no, I think just with the surgery part. I think I have gained 10 pounds in the last probably year or so, but outside of that, you know, after
Okay.
that, pretty stable.
Any weakness,
No, no weakness.
fatigue,
No,
fever?
no fever.
Okay. Heartburn, you said, does it burn down into your chest or is it just in your throat?
It's not even really a heartburn. It's more like the food just sits there.
Okay.
Doesn't want to go down.
Okay. And you said
And,
you
that,
did.
and then
do have-
sometimes that's painful and it doesn't want to go down.
Okay. Appetite is still good.
Yeah, well, yeah, until I eat.
Right. Okay. All right. And any diarrhea or problems with your stool?
I do have constipation, but I just usually use Metamucil and just do whatever the label says. I take that daily.
Okay. All right. Any excessive gas or belching?
No, mm-mm.
Okay. Any rectal bleeding or black tarry stools?
No,
Pain with a stool?
no.
No. Okay. And okay. Well, let's see. So food intolerance, pretty much just swallowing.
Just when I eat, it just sits there.
Okay. All right. Well, we are going to see what we can get done for you. Okay.
Okay.
All right. Thank you.
All right, are you ready?
I'm ready.
Okay. Hi, I'm Sherry Bushnell, student family nurse practitioner. What name is the best name to call you by?
Just call me Jane.
Okay, Jane. We're going to be taking a health history today, and so we're just going to be sitting down and talking for a bit. I'm going to ask you questions, and most will be pretty easy for you, but we're doing what's called a focused exam today, which means that we're going to be centering on the symptoms that are really concerning you today, because we really want to make sure that you're getting whatever resolved is bothering you. So are you ready?
I'm ready.
All right. Can you tell me if you could name what the symptom that's bothering you the most, can you tell me about that?
I have a headache.
Headache, okay. And when did that start?
About 1 day ago.
Okay, and can you touch where it hurts on your head?
It's just pounding all over.
All over, okay.
Mm-hmm.
And so anything else, any other symptoms that are bothering you besides the headache?
No.
Okay. All right, so how long does it last normally?
It's kind of just been constant.
Constant. Since a day ago, like 24 hours even at night while you're sleeping, can you sleep?
Yeah, the last 24 hours.
Wow.
No problem sleeping though. I was able to sleep.
You're able to sleep through it. Okay, well that's good.
Mm-hmm.
How about any double vision?
No.
Any weakness? You feel weak?
No.
How about any loss of sensation during your headache? Do you feel like you're losing sensation in your fingers or
Oh wait. I have been seeing some zigzag lines. Yeah.
zigzag lines? Okay.
Yeah.
And is that constant during your headache or does it come and go?
It's just comes and goes.
Comes and goes. Okay. And then is that brought on by something in particular? Do you notice?
Well, my eyes are real sensitive to the light.
Oh, okay. And so are you talking about light outside, like sunlight or
No, any light at all makes it hurt.
Oh, that's nice. Does it get any worse when you're sneezing or coughing or move your head suddenly side to side or anything?
No.
Okay. And have you had a fever in the last few days or a stiff neck or sore throat or earache or
And my
sinus?
ears have been sensitive to sound.
And when did that start?
About the same time as the zigzag lines and the headache. It's all been one big process. Just
Oh, my
pounding.
Oh, goodness. Are you able to eat?
Yes.
Okay. And eat normally or?
Yes.
Okay. And there's no nausea associated with it or anything?
Oh, yes, I did. I vomited in the car on the way to the office. I did.
Oh, my goodness.
Yeah. Yeah, I've been sick.
Okay. And so, but you haven't had a fever or anything or diarrhea or anything with it?
No.
So you feel like the headache is the nausea is associated with the headache. Mm. Have you ever had these headaches before like this, or? Have you ever had headaches like this before?
No, no,
No.
never had any.
Huh.
This was the first time.
Wow. Is it scaring you? Do you feel
A
like,
little bit, especially after I vomited in the car.
wow. So what we want to make sure is that you're not having a stroke, of course.
Yes.
So you're not having any loss of sensation or anything like that. How about when you, darkness coming in from the side? You see zigzag lines, but did things flicker while you see the zigzag lines? Any stop?
No,
Okay.
no, just the zigzag lines and the ear sensitive and the light sensitive.
Okay. How about, can you describe the pain to me? Just, is it pulsing or throbbing or
The pounding.
pounding? Okay.
Hmm.
So you feel like you're able to do most activities, or are you pretty much sitting down in a chair in bed?
No, just been in a quiet room where it's kind of dark and quiet.
Can you tell me a little bit about any medications you've taken lately?
Well, I took some naproxen, 500 milligrams, and it helped a little bit.
Okay. Any other vitamins or minerals or supplements or anything you take normally that would be out of ordinary for you?
No,
No vertigo or dizziness? Like, are
no.
you walk around? Okay. So, let's see. Have you had a tendency to feel like you're going to faint with this headache? Is there any?
No.
No? Okay. That's good. So it came on really sudden, huh? Just really fast.
Yes.
No heart palpitations with that?
No.
Did you have seizures at all?
No.
Any involuntary movements or tremors? Is your hand shaking a little bit or?
No.
Okay. And so do you think that when you are up and about walking that the headache is worse, or is it just staying the same?
Just kind of staying the same.
Wow. Well, I think that gives me a really good picture of your headache here. Let's just do a quick review of some systems that will kind of help us know what a baseline is for you. So what is your usual weight?
Around 150 pounds.
Okay, and any changes recently, like clothing that fits tighter or looser than before?
No.
Okay, so let's talk about skin. Have you had any rashes or lumps or sores or itching or dryness? Changes
No.
in color? How about, you said you didn't have any head injury that precipitated the headache. You didn't bang it?
Mm-mm, just came out of the blue.
No chiropractic adjustment or?
No.
Okay. All right, and any swollen glands, or have you noticed anything painful in this area?
No.
Okay, and let's go to your tummy area. Are you having any trouble swallowing or heartburn or anything like that? You said you've had some vomiting. How about bowel movement? Have you been constipated at all?
No.
No, everything looks good there, huh?
Yes.
How about urinary frequency? Voiding, any kind of kidney flank pain?
No problems there.
You get up in the middle of the night to void?
No.
Hey, boy, it's unhealthy. Let's talk a little bit about, yeah, let's talk a little bit about kind of how you feel about, are you nervous? Have you had some tension lately that's unusual, like mood depression or changes?
No.
Any memory
No
change?
problems. Mm-mm.
All right. So we've got a headache here. Let me just recap for you so that we can have a communication. I'm getting everything down that you told me. Is that you've had a sudden headache about 24 hours ago that is accompanied a pounding headache with a vertical zigzag type lines that kind of, and you have been feeling fine up to this point in time.
Yes.
All right. Okay, and does it feel like it's on one side or the other, or just kind of all over general? Are you there?
Can you hear me?
Yep, I can hear you.
Okay. Yeah. It's just general. Yeah.
General? Okay.
Mm-hmm.
So let's talk a little bit about your past medical history. Have you had any pregnancies?
Yes.
How many pregnancies have you had?
One.
And is this a child that you have now?
It is.
Okay.
I
And
had preeclampsia at 37 weeks in the last pregnancy.
Okay. Any miscarriages or anything?
No.
Okay. And how old is your baby now?
She's 1.
Okay. Any other complications besides preeclampsia?
Well, they thought I had high blood pressure, and my OB wanted me to see a doctor, but I was too busy with the baby.
Okay. So have you had your blood pressure taken recently?
Yes.
Okay. And what was that, the most recent one you had? When was that?
Just a few days ago.
And what was it? Do you remember?
It was normal.
Okay. Now let's talk a little bit. Have you had any swelling in your hands or feet or face?
No.
Okay. Any pain in your upper abdomen here in the area around your tummy?
No. Just the pounding in my head, about 8 to 10.
Oh, on the pain scale?
Yeah,
Eight.
about 8 out of 10.
Wow, that's pretty strong.
Mm-hmm.
Any allergies?
No.
Okay. And any surgeries that you've had in the last couple of years?
I had a cesarean birth. They couldn't get my baby going, and my OB said I was getting too sick.
Mm-hmm. C-section. And then how far along were you when you had your C-section? Were you term?
Yes.
Okay. And did your baby do okay?
Yes. Baby's fine.
Are you breastfeeding right now?
No.
Okay. So no other hospitalizations or sicknesses since you had your baby then?
No.
Okay. Tell me about your mom. How old is she?
She's about 55.
Okay, and how is she doing? Is she healthy?
She has type 2 diabetes.
And how about your dad?
My dad died at age 60 of lung cancer.
Any brothers or sisters?
No.
Okay. How about your grandparents? Are they still living?
No. Yeah, oh, yes, they are. They're fine.
Okay. So your mom's being treated for type 2 diabetes. Is she on medication? Is she on insulin?
No.
So she's self-treating?
Yes.
Okay. All right. And so let's talk a little bit. Is your head doing okay? It's probably sitting here pounding. All these questions aren't helping any. I'm sorry.
Yes.
Have you had any kind of emotional life events lately, like marriage or, problems at work or educational challenges or anything?
No. No problems.
Do you smoke cigarettes?
No.
Do you take marijuana in any form or for recreational health reasons or anything?
No. No drug.
Okay. And how about alcohol? Do you drink alcohol?
No. No alcohol.
And do you exercise? Can you tell me a little bit
Yes.
about your exercise history? What do you do for exercise?
Treadmill, bicycle, just basic regular exercise, just calisthenics.
Okay. And so resources, you're safe and healthy, you have enough resources for food, and you're in a safe environment?
Yes.
Okay. All right. Well, going to have to go ahead and think about some of the symptoms you have here, and hopefully we'll be able to get you some medication and get you on the road to recovery here. It must be really frustrating for you having a headache that's not going away.
Yes, and I did tell you wrong. I do have 2 children. I'm sorry. I have a daughter who's age 5 and a son who's age 1.
Okay, tell me about your daughter, age 5. How that birth?
They're both alive and well.
No medical problems at all?
No.
And you haven't had any confusion associated with the headache, is that right?
No.
Okay, no numbness in your fingers and hands and toes.
No.
No blacking out. Okay. Let's see. No double vision.
No.
Problems forming.
Just the zigzag lines that we talked about.
Tell me a little bit about your blood pressure. You've had high blood pressure with preeclampsia. Have you ever had it ever before?
Only during pregnancy.
Only during the preeclampsia. Okay.
Mm-hmm.
That's good. Okay, well, I'll go ahead and go in my room back here and see what I can find.
Okay, thank you.
Nice to meet you.
Nice to meet you too. Thank you.
Okay.